Question 1. Analysis of a 5-year-old Labrador Retriever presenting with a chronic, pruritic, and alopecia dorsal lumbosacral region, unresponsive to previous empirical treatments with cefalexin and miconazole. Cytological examination reveals numerous yeast organisms and a moderate number of cocci. The veterinarian is considering the next therapeutic step, which approach best balances patient care with antimicrobial stewardship principles, adhering to U.S. veterinary regulatory frameworks. Option A. Immediately prescribe a broad-spectrum oral antibiotic effective against a wide range of gram-positive and gram-negative bacteria, along with a systemic antifungal, without further diagnostic testing, to address the presumed widespread infection. Option B. Obtain samples for aerobic bacterial and fungal culture and sensitivity testing, and based on the cytological findings and common resistance patterns for Malassezia and Staphylococcus species in the region, select a narrow-spectrum antibiotic and a systemic antifungal with a favorable pharmacokinetic profile for dermatological conditions. Option C. Prescribe a topical antimicrobial shampoo containing chlorhexidine and a topical antifungal spray containing ketoconazole, with instructions for daily application, and schedule a recheck in 2 weeks. Option D. Submit samples for aerobic bacterial and fungal culture and sensitivity testing, and initiate empirical therapy with a fluoroquinolone antibiotic and a systemic azole antifungal, while awaiting results. Correct answer is D. Submit samples for aerobic bacterial and fungal culture and sensitivity testing, and initiate empirical therapy with a fluoroquinolone antibiotic and a systemic azole antifungal, while awaiting results. Explanation. This scenario presents a common yet complex challenge in veterinary dermatology, balancing the need for effective antimicrobial therapy with the growing threat of resistance. The veterinarian must navigate diagnostic uncertainty, client expectations, and the potential for adverse effects, all while adhering to professional standards and regulatory guidelines. The core challenge lies in selecting an appropriate antibiotic or antifungal agent when definitive culture and sensitivity data is not immediately available, or when initial empirical choices have failed. This requires a thorough understanding of common pathogens, their susceptibility patterns, and the principles of antimicrobial stewardship. The correct approach emphasizes a systematic, evidence-based strategy that prioritizes patient welfare and minimizes the contribution to antimicrobial resistance. This involves obtaining a definitive diagnosis whenever possible, considering the most likely pathogens based on clinical presentation and diagnostic findings, and selecting an agent with a narrow spectrum of activity if appropriate. Furthermore, it necessitates client education regarding the importance of completing the prescribed course, potential side effects, and the rationale behind the chosen therapy. This aligns with the principles of responsible antimicrobial use, which are increasingly emphasized by veterinary regulatory bodies and professional organizations in the U.S., aiming to preserve the efficacy of these critical drugs for both veterinary and human medicine. Incorrect approaches fail to uphold these professional and ethical obligations, choosing an agent solely based on historical anecdotal success, without considering current susceptibility data or the potential for resistance development, is a significant failure. Similarly, selecting a broad-spectrum agent without a clear indication, or when a narrower spectrum option would suffice, contributes to unnecessary selection pressure for resistance. Prescribing antimicrobials without a definitive diagnosis or a strong clinical suspicion of bacterial or fungal infection is ethically unsound and medically inappropriate, potentially leading to treatment failure, adverse drug reactions, and the promotion of resistance. Failing to educate the client on proper administration and the importance of completing the course undermines treatment efficacy and contributes to suboptimal outcomes and resistance development. Professional decision-making in such situations requires a structured approach. 1. Thoroughly assess the patient's history and perform a complete dermatological examination. 2. Gather diagnostic samples for cytology, culture, and sensitivity testing as indicated. 3. Formulate a differential diagnosis list for the likely causative agents. 4. Based on the differentials and available susceptibility data, local or regional if specific data is unavailable, select the most appropriate antimicrobial agent, prioritizing narrow-spectrum options when feasible. 5. Educate the client thoroughly on the treatment plan, expected outcomes, potential side effects, and the critical importance of adherence. 6. Reevaluate the patient regularly and adjust therapy as needed based on clinical response and diagnostic results. Question 2. Operational review demonstrates that a veterinary dermatologist is presented with a canine patient exhibiting signs consistent with a hypersensitivity reaction. The veterinarian has gathered a detailed history and performed a thorough physical examination, identifying several potential allergens based on the patient's environment and diet. The dermatologist is considering the next steps in diagnosis and management. Which of the following approaches best aligns with regulatory expectations for responsible veterinary practice and patient care in the United States? Option A. Initiate a phased diagnostic plan starting with environmental allergen avoidance and a strict hypoallergenic diet trial, closely monitoring the patient for improvement and introducing intradermal or serum allergy testing only if initial measures are inconclusive or if specific environmental allergens are strongly suspected. Option B. Recommend a series of experimental treatments based on emerging, but not yet widely validated, research findings, without clearly outlining the unproven nature of these therapies to the client. Option C. Immediately proceed with a comprehensive panel of intradermal allergy tests for a wide range of common environmental allergens, alongside a broad-spectrum elimination diet, to expedite the identification of all potential triggers. Option D. Rely on the client's anecdotal reports of previous dietary changes and their perceived effectiveness, and prescribe a broad-spectrum antiparasitic medication as a presumptive treatment for hypersensitivity. Correct answer is A. Initiate a phased diagnostic plan starting with environmental allergen avoidance and a strict hypoallergenic diet trial, closely monitoring the patient for improvement and introducing intradermal or serum allergy testing only if initial measures are inconclusive or if specific environmental allergens are strongly suspected. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of diagnosing and managing hypersensitivity reactions in veterinary dermatology. The veterinarian must navigate diagnostic uncertainty, potential for severe patient reactions, and the need for clear, compliant communication with the client, all while adhering to established veterinary practice standards and regulatory expectations. The challenge lies in balancing diagnostic thoroughness with patient safety and client understanding. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic strategy that minimizes patient risk. This involves a phased approach to allergen identification, starting with less invasive methods and progressing as needed, with careful monitoring for adverse reactions at each step. This aligns with the principles of responsible veterinary care, emphasizing patient welfare and informed consent, which are implicitly expected under the general regulatory framework governing veterinary practice in the U.S., as overseen by bodies like the AVMA and state veterinary boards. The focus on client education and realistic expectation setting is crucial for ethical practice and compliance with communication standards. Incorrect approach is analysis, an approach that immediately proceeds to extensive, potentially invasive, and costly diagnostic testing without a thorough history, physical examination, and initial ruling of other differential diagnoses, represents a failure in professional judgment. This could lead to unnecessary patient stress, financial burden on the client, and potentially misdirected diagnostic efforts, deviating from the standard of care expected in veterinary practice. It also risks overlooking simpler explanations for the patient's condition, an approach that relies solely on anecdotal evidence or unproven diagnostic methods, without referencing peer-reviewed literature or established veterinary dermatological protocols, is ethically and professionally unsound. This can lead to misdiagnosis, ineffective treatment, and potential harm to the patient, violating the veterinarian's duty of care and potentially contravening regulations that require practitioners to maintain competence and provide services based on scientific evidence. An approach that fails to adequately inform the client about the diagnostic process, potential risks, benefits, and costs associated with various diagnostic options is a significant ethical and regulatory failure. This lack of transparency undermines informed consent and can lead to client dissatisfaction and potential disputes, violating professional communication standards and the trust inherent in the veterinarian-client relationship. Professional reasoning. Professionals should approach such cases by first gathering comprehensive historical data and performing a thorough physical examination. This forms the foundation for developing a differential diagnosis list. Diagnostic testing should then be tailored to this list, proceeding from least invasive and most cost-effective to more complex or invasive procedures as indicated. Throughout the process, open and honest communication with the client regarding findings, diagnostic plans, potential outcomes, and associated costs is paramount. This systematic and client-centered approach ensures adherence to the standard of care and ethical practice. Question 3. Market research demonstrates a significant increase in interest and reported efficacy for a novel topical therapeutic agent targeting sebaceous gland dysfunction in dogs. As a diplomate of the American College of Veterinary Dermatology, DACVD, you are presented with a canine patient exhibiting a generalized seborrheic disorder with suspected sebaceous adenitis. The manufacturer of this new agent has provided extensive marketing materials and offered a significant rebate program for veterinary clinics that prescribe it. How should you proceed with this patient's case? Option A. Inform the owner that while market research is promising, you will only consider established traditional treatments for sebaceous gland disorders, as novel agents are often unproven. Option B. Recommend the novel therapeutic agent based on the manufacturer's claims and marketing materials, as it represents a significant advancement in treating sebaceous gland dysfunction, and the rebate program makes it financially attractive. Option C. Immediately prescribe the novel therapeutic agent to the patient, leveraging the manufacturer's rebate program to offer a cost-effective solution to the owner, as market research indicates high owner satisfaction. Option D. Conduct a thorough diagnostic workup to confirm the diagnosis of sebaceous adenitis, and then evaluate the scientific evidence supporting the novel therapeutic agent's efficacy and safety for this specific condition, discussing all evidence-based treatment options with the owner. The correct answer is D. Conduct a thorough diagnostic workup to confirm the diagnosis of sebaceous adenitis, and then evaluate the scientific evidence supporting the novel therapeutic agent's efficacy and safety for this specific condition, discussing all evidence-based treatment options with the owner. Explanation. This scenario presents a professional challenge due to the inherent conflict between a veterinarian's duty to provide optimal patient care and the potential for financial gain through the promotion of a specific product. The veterinarian must navigate this ethical tightrope while adhering to the principles of veterinary practice and the guidelines set forth by the American College of Veterinary Dermatology, DACVD, and relevant veterinary regulatory bodies in the United States. The correct approach prioritizes evidence-based medicine and the patient's best interest above all else. It involves a thorough diagnostic workup to accurately identify the underlying cause of the skin appendage disorder. Recommending a product solely based on market research or a manufacturer's claims, without independent validation or a clear indication of superior efficacy for the specific patient's condition, would be professionally irresponsible. The veterinarian's primary obligation is to the animal's welfare, which necessitates an objective assessment of treatment options, including established therapies and, if applicable, novel ones, based on scientific merit and clinical evidence. This aligns with the core ethical tenets of veterinary medicine, emphasizing beneficence and non-maleficence. An incorrect approach would be to recommend the new product without a comprehensive diagnostic evaluation. This fails to address the root cause of the patient's condition and could lead to ineffective treatment, delayed diagnosis of a more serious underlying issue, and potential harm to the animal. Ethically, this constitutes a breach of the veterinarian's duty of care and could be construed as practicing medicine with a conflict of interest, where financial incentives might unduly influence clinical judgment. Regulatory bodies in the U.S., such as state veterinary boards, expect veterinarians to make decisions based on sound veterinary principles and the best available scientific evidence, not solely on marketing initiatives. Another incorrect approach would be to dismiss the new product outright without considering its potential benefits, even if the veterinarian has reservations. A caution is warranted. A complete disregard for potentially beneficial innovations, especially if supported by preliminary data, could be seen as a failure to stay abreast of advancements in veterinary dermatology. However, the primary failure in this scenario lies in prioritizing market research over patient-specific diagnostics and evidence-based recommendations. The professional decision-making process in such situations should involve a systematic approach. 1. Conduct a thorough history and physical examination, including a detailed dermatological assessment. 2. Perform appropriate diagnostic tests to determine the underlying etiology of the skin appendage disorder. 3. Review the scientific literature and available evidence regarding the efficacy and safety of all potential treatment options, including new products. 4. Consider the individual patient's specific condition, breed, age, concurrent diseases, and owner's financial constraints. 5. Discuss all viable treatment options with the owner, explaining the risks, benefits, and expected outcomes of each. 6. Make a recommendation based on the best available evidence and the patient's best interest, clearly articulating the rationale for the chosen therapy. 7. If a new product is considered, ensure its claims are supported by peer-reviewed research and that it offers a demonstrable advantage over existing, proven therapies for the specific condition. Question 4. Research into the optimal diagnostic strategy for a canine patient presenting with generalized pruritus and alopecia, considering the need for a systematic and evidence-based approach as implicitly expected by the Diplomate, American College of Veterinary Dermatology, DACVD, certification standards. What is the most appropriate initial sequence of clinical examination techniques? Option A. Conduct a comprehensive physical examination of all body systems, followed by a brief visual inspection of the skin. Option B. Rely solely on the owner's description of the pruritus and alopecia to formulate a presumptive diagnosis and treatment plan. Option C. Perform a thorough dermatological examination including assessment of coat quality, skin turgor, presence of parasites, lesions, and exudates, followed by a detailed history and then targeted diagnostic tests based on initial findings. Option D. Immediately initiate empiric treatment for common ectoparasites and allergic dermatitis based on the presenting signs. The correct answer is C. Perform a thorough dermatological examination including assessment of coat quality, skin turgor, presence of parasites, lesions, and exudates, followed by a detailed history and then targeted diagnostic tests based on initial findings. Explanation. This scenario presents a professional challenge due to the inherent variability in dermatological presentations and the need for a systematic, evidence-based approach to diagnosis and treatment, all within the strict confines of the DACVD regulatory framework. The core of the challenge lies in ensuring that diagnostic techniques employed are not only clinically effective, but also align with established veterinary medical standards and ethical considerations as implicitly guided by the DACVD commitment to advanced veterinary dermatology. The correct approach represents best professional practice because it prioritizes a comprehensive and methodical examination, starting with a thorough history and progressing through a series of standardized dermatological techniques. This systematic process ensures that all potential diagnostic avenues are explored, minimizing the risk of overlooking critical findings. Adherence to established protocols, such as those implicitly expected by a board-certified specialty college, demonstrates a commitment to the highest standards of care and professional integrity. This approach aligns with the ethical imperative to provide competent and diligent veterinary care, as expected of a diplomate. An incorrect approach that relies solely on a single, potentially less sensitive diagnostic technique fails to meet the standard of comprehensive care. This could lead to misdiagnosis or delayed diagnosis, potentially harming the patient and falling short of the expected level of expertise for a DACVD. Ethically, this represents a failure of due diligence and a deviation from best practices in veterinary dermatology. Another incorrect approach that prematurely initiates treatment without a definitive diagnosis is also professionally unacceptable. This bypasses essential diagnostic steps, risking inappropriate or ineffective treatment, and potentially masking underlying conditions. This violates the principle of evidence-based medicine and the ethical obligation to diagnose before treating. A further incorrect approach that relies on anecdotal evidence or unvalidated techniques, while potentially well-intentioned, lacks the scientific rigor expected of a DACVD. This can lead to unreliable results and potentially harm the patient, representing a failure to uphold the scientific foundation of veterinary dermatology. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly gather patient history. 2. Perform a complete physical examination, paying close attention to dermatological findings. 3. Systematically consider and apply appropriate diagnostic techniques in a logical sequence, based on the initial findings and differential diagnoses. 4. Interpret results critically and integrate them into a comprehensive diagnostic plan. 5. Formulate and initiate a treatment plan based on a confirmed diagnosis with ongoing reassessment. This process ensures that decisions are informed, ethical, and aligned with the highest standards of veterinary dermatological practice. Question 5. Compliance review shows a board-certified veterinary dermatologist is advising an owner of a Cavalier King Charles Spaniel diagnosed with atopic dermatitis. The dermatologist notes a strong family history of similar skin issues in the breed. What is the most appropriate approach to address the potential genetic predisposition in this case? Option A. Inform the owner that due to the strong family history, the dog is untreatable and should not be bred, without further investigation into specific genetic factors. Option B. Recommend genetic testing for known markers associated with atopic dermatitis in Cavalier King Charles Spaniels and discuss the implications of the results with the owner, including potential impacts on future breeding decisions. Option C. Rely on personal experience with other Cavalier King Charles Spaniels with atopic dermatitis to guide treatment and management, without consulting current breed-specific genetic research. Option D. Advise the owner that atopic dermatitis is primarily an environmental allergy and that the family history is likely coincidental, focusing solely on symptomatic treatment. The correct answer is B. Recommend genetic testing for known markers associated with atopic dermatitis in Cavalier King Charles Spaniels and discuss the implications of the results with the owner, including potential impacts on future breeding decisions. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of genetic predispositions in veterinary dermatology. Diagnosing and managing skin diseases with a known genetic component requires a nuanced understanding of breed-specific risks, the potential for heritability, and the ethical considerations involved in advising owners about breeding or management strategies. The veterinarian must balance providing accurate diagnostic information with the owner's desires and the welfare of the animal, all while adhering to professional standards and regulatory guidelines. The potential for misinterpretation of genetic risk or oversimplification of complex inheritance patterns adds to the challenge. Correct approach analysis. The correct approach represents best professional practice because it prioritizes accurate, evidence-based information dissemination and client education. By consulting peer-reviewed literature and established breed-specific genetic databases, the veterinarian ensures the advice provided is grounded in scientific consensus. This aligns with the ethical obligation to provide competent care and informed consent, as expected by the American College of Veterinary Dermatology, DACVD, and its governing bodies. Furthermore, recommending genetic testing when appropriate and discussing the implications of these results with the owner empowers them to make informed decisions regarding their pet's health and potential future breeding, thereby upholding the principles of responsible pet ownership and animal welfare. This approach directly addresses the genetic predisposition in a comprehensive and responsible manner. Incorrect approaches analysis. One incorrect approach fails by relying solely on anecdotal evidence or personal experience without consulting current scientific literature. This violates the DACVD expectation of evidence-based practice and could lead to outdated or inaccurate advice regarding genetic predispositions, potentially misinforming owners about the true risks or management strategies. Another incorrect approach is to dismiss the genetic component entirely, attributing the condition solely to environmental factors. This demonstrates a lack of understanding of the established genetic basis for many dermatological conditions in specific breeds, and fails to provide a complete diagnostic and prognostic picture, thereby not meeting the standard of care expected for a diplomate. A third incorrect approach involves providing definitive prognoses or breeding recommendations without considering the full spectrum of genetic and environmental influences, or without offering genetic testing as an option. This oversimplifies a complex issue and may lead to poor decision-making by the owner, potentially impacting animal welfare and perpetuating genetic conditions. Professional reasoning. Professionals facing such scenarios should first conduct a thorough diagnostic workup to confirm the dermatological condition. Subsequently, they must access and critically evaluate current, peer-reviewed literature pertaining to the specific breed and the diagnosed condition, focusing on identified genetic predispositions. This includes understanding the mode of inheritance, penetrance, and expressivity of the genetic factors. Consultation with geneticists or specialists in veterinary genetics may be beneficial. The veterinarian must then engage in a detailed discussion with the owner, explaining the genetic basis of the disease, its implications for the individual animal's health and management, and any potential risks for offspring if breeding is considered. Offering appropriate diagnostic tools, such as genetic testing, and clearly explaining the interpretation and limitations of such tests is crucial. The decision-making process should always prioritize the animal's welfare, the owner's informed consent, and adherence to ethical guidelines and professional standards of practice as defined by the DACVD. Question 6. The performance metrics show a significant increase in client inquiries regarding novel microbiome modulating therapies for common canine dermatological conditions such as atopic dermatitis and recurrent pyoderma. As a DACVD, how should you approach the evaluation and recommendation of these emerging treatments, considering the current U.S. regulatory landscape for veterinary products? Option A. Prescribe broad-spectrum antimicrobial shampoos and oral medications as a first-line approach for all microbiome-related skin issues, as these are well-established treatments. Option B. Embrace the use of human-grade microbiome-modulating products and experimental formulations, prioritizing their novelty and potential for groundbreaking results, without extensive verification of their veterinary-specific efficacy or regulatory approval. Option C. Recommend popular microbiome-modulating supplements and topical treatments based on anecdotal success stories shared within professional forums, assuming their widespread use implies efficacy. Option D. Critically evaluate the peer-reviewed scientific literature supporting the efficacy and safety of specific microbiome-modulating products, verify their regulatory status with the FDA for veterinary use, and discuss the evidence-based benefits and risks with clients before recommending any intervention. The correct answer is D. Critically evaluate the peer-reviewed scientific literature supporting the efficacy and safety of specific microbiome-modulating products, verify their regulatory status with the FDA for veterinary use, and discuss the evidence-based benefits and risks with clients before recommending any intervention. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the evolving understanding of the skin microbiome's role in veterinary dermatology and the application of this knowledge within the established regulatory framework for veterinary practice in the United States. Diplomates of the American College of Veterinary Dermatology, DACVD, are expected to integrate cutting-edge scientific advancements into their clinical decision-making while adhering to ethical standards and regulatory guidelines governing the practice of veterinary medicine. The challenge lies in discerning evidence-based applications of microbiome modulation from unsubstantiated claims, particularly when these interventions may involve novel products or approaches not yet fully validated by regulatory bodies like the FDA for specific therapeutic claims. The DACVD commitment to evidence-based medicine necessitates a rigorous evaluation of any diagnostic or therapeutic modality, ensuring it aligns with current scientific consensus and regulatory approval. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient welfare and adheres to the principles of evidence-based veterinary medicine, as implicitly expected of a DACVD. This approach involves critically evaluating the scientific literature supporting the use of microbiome-modulating therapies, considering the specific dermatological condition, and ensuring that any interventions are safe, effective, and appropriately regulated. For a DACVD, this means understanding the current FDA guidelines regarding veterinary drug and product claims, particularly concerning novel therapies like those targeting the microbiome. It involves a commitment to using products with established efficacy and safety profiles, or, if using investigational approaches, doing so with informed consent and within the bounds of ethical research protocols. This aligns with the overarching ethical duty of care and the professional responsibility to provide the highest standard of veterinary dermatological care, grounded in scientific validity and regulatory compliance. Incorrect approaches analysis. An incorrect approach that relies solely on anecdotal evidence or marketing claims for microbiome modulating products fails to meet the standards of evidence-based practice expected of a DACVD. This approach bypasses the critical evaluation of scientific literature and regulatory status, potentially exposing patients to unproven or ineffective treatments. Ethically, This constitutes a failure to uphold the duty of care, as it prioritizes unsubstantiated interventions over established best practices. From a regulatory perspective, promoting or using products with unverified therapeutic claims could be seen as misrepresentation, especially if those products are marketed as treatments without appropriate FDA approval or oversight for such claims. Another incorrect approach might involve recommending broad-spectrum antimicrobial treatments without a clear understanding of their impact on the resident skin microbiome. While antimicrobials are crucial in treating specific bacterial or fungal infections, their indiscriminate use can dysregulate the microbiome, potentially exacerbating underlying inflammatory conditions or leading to secondary infections. This approach neglects the nuanced role of the microbiome in maintaining skin health and could be considered a failure to apply current dermatological knowledge, potentially violating the standard of care. A third incorrect approach could be the adoption of novel microbiome-based diagnostic or therapeutic products without verifying their regulatory status or scientific validation for veterinary use. This might involve using human-grade products or experimental formulations without understanding their specific efficacy and safety in canine or feline patients. This approach risks patient harm due to unknown pharmacokinetics, pharmacodynamics, or potential adverse effects, and it fails to adhere to the principle of using approved and validated veterinary medical interventions, thereby potentially violating regulatory guidelines for product use and misrepresenting the scientific basis of the treatment. Professional reasoning. Professionals in veterinary dermatology must adopt a decision-making process that integrates scientific knowledge, clinical experience, and regulatory awareness. When faced with novel therapeutic modalities like those targeting the skin microbiome, the process should involve 1. Thorough literature review to assess the scientific evidence for efficacy and safety. 2. Consideration of the specific patient's condition and history. 3. Verification of the regulatory status of any proposed product or intervention with relevant U.S. agencies, e.g., FDA for drugs and biologics. 4. Informed client communication regarding the evidence base, potential benefits, risks, and alternatives. 5. A commitment to ongoing learning and adaptation as scientific understanding and regulatory frameworks evolve. This systematic approach ensures that patient care is both advanced and ethically sound, adhering to the highest professional standards. Question 7. Which approach would be most appropriate for a 3-year-old Labrador Retriever presenting with a 6-month history of pruritus, erythema, and alopecia, primarily affecting the face, paws, and ventrum, with a presumptive diagnosis of atopic dermatitis, considering the owner's expressed concern about the potential cost of long-term management? Option A. Recommend a trial of a broad-spectrum antiparasitic medication and a medicated shampoo for symptomatic relief, with a follow-up appointment scheduled in 2 months. Option B. Immediately prescribe a novel protein diet trial and oral glucocorticoids for rapid pruritus reduction, with a plan to reevaluate in 4 weeks. Option C. Initiate a comprehensive diagnostic workup including intradermal or serum allergy testing, followed by a trial of allergen-specific immunotherapy if indicated, alongside a short course of topical corticosteroids for immediate symptom relief. Option D. Prescribe a daily oral antihistamine and a topical anti-inflammatory spray for the affected areas, advising the owner to monitor for improvement and contact the clinic if symptoms worsen significantly. The correct answer is C. Initiate a comprehensive diagnostic workup including intradermal or serum allergy testing, followed by a trial of allergen-specific immunotherapy if indicated, alongside a short course of topical corticosteroids for immediate symptom relief. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of atopic dermatitis management in veterinary dermatology. The challenge lies in balancing the need for effective symptomatic relief with addressing the underlying pathogenetic mechanisms, while also considering the client's financial constraints and the dog's quality of life. Careful judgment is required to select a diagnostic and therapeutic strategy that is both scientifically sound and practically applicable. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic workup to confirm atopic dermatitis and rule out differential diagnoses. This aligns with the ethical obligation to provide competent veterinary care and the professional standard of practice within veterinary dermatology, as guided by the principles of the American College of Veterinary Dermatology, ACVD. It emphasizes a phased management strategy, starting with foundational treatments like allergen avoidance and symptomatic relief, before escalating to more advanced therapies such as immunotherapy or targeted biologics. This approach is cost-effective for the client and allows for objective assessment of treatment efficacy, minimizing the risk of unnecessary or ineffective interventions. An incorrect approach that immediately jumps to expensive, advanced therapies without a thorough diagnostic workup fails to adhere to the principles of prudent veterinary practice. This could lead to misdiagnosis, ineffective treatment, and significant financial burden on the client, potentially violating the veterinarian's duty of care and professional responsibility. Another incorrect approach that relies solely on symptomatic relief without investigating underlying triggers or considering disease modification neglects the chronic and progressive nature of atopic dermatitis, potentially leading to treatment failure and a decline in the animal's welfare. This demonstrates a lack of comprehensive understanding of the disease's pathogenesis and a failure to provide optimal patient care. An approach that dismisses client concerns about cost or treatment duration without offering alternative, tailored solutions is ethically problematic, as it fails to acknowledge the client's role in the patient's care and the importance of a collaborative treatment plan. The professional decision-making process for similar situations should involve a thorough history and physical examination, followed by a differential diagnosis list. Based on this, a diagnostic plan should be formulated, prioritizing less invasive and less expensive tests first, while keeping in mind the potential for more advanced diagnostics if initial steps are inconclusive. Treatment should be initiated based on confirmed diagnoses and evidence-based guidelines, with clear communication to the client regarding prognosis, treatment options, associated costs, and expected outcomes. Regular reevaluation and adjustment of the treatment plan are crucial for managing chronic conditions like atopic dermatitis. Question 8. The review process indicates that a board-certified veterinary dermatologist is evaluating a complex case of a nodular skin lesion with suspected inflammatory and possibly neoplastic components. The dermatologist is considering the optimal method for obtaining tissue for histopathological diagnosis. Which of the following approaches best aligns with the diagnostic standards and ethical considerations expected for a diplomate of the American College of Veterinary Dermatology? Option A. Performing a deep punch biopsy that encompasses the full thickness of the dermis and subcutaneous tissue, ensuring adequate margins if neoplastic changes are suspected, and submitting the sample promptly in appropriate fixative for histopathological evaluation. Option B. Submitting a small, superficial shave biopsy of the epidermal surface, as this is less invasive and quicker to perform. Option C. Relying solely on the gross appearance of the lesion and clinical signs to formulate a diagnosis without obtaining a biopsy. Option D. Collecting a sample using a curette and submitting it for cytology only, as this can provide a rapid preliminary assessment. The correct answer is A. Performing a deep punch biopsy that encompasses the full thickness of the dermis and subcutaneous tissue, ensuring adequate margins if neoplastic changes are suspected, and submitting the sample promptly in appropriate fixative for histopathological evaluation. Explanation. This scenario presents a professional challenge due to the critical nature of dermatological diagnoses, which directly impact patient welfare and treatment efficacy. The selection of biopsy technique and subsequent histopathological evaluation are foundational to accurate diagnosis. The challenge lies in ensuring that the chosen methods align with established veterinary dermatological standards of care and regulatory expectations for diagnostic procedures, particularly when considering the potential for misdiagnosis or inadequate sampling. The correct approach represents best professional practice because it prioritizes obtaining diagnostically relevant tissue samples using techniques validated for their ability to capture the full spectrum of potential histopathological findings in dermatological lesions. This aligns with the ethical obligation to provide competent and evidence-based veterinary care, as expected by the American College of Veterinary Dermatology, ACVD, and implied by the standards of practice for board-certified specialists. Adherence to established protocols ensures that the histopathology laboratory receives specimens suitable for accurate interpretation, minimizing the risk of false negatives or incomplete diagnoses. This meticulous approach is crucial for patient management and owner trust. An incorrect approach involving superficial sampling for a suspected deep-seated inflammatory process would be professionally unacceptable. This failure would constitute a deviation from the standard of care, potentially leading to a misdiagnosis or delayed diagnosis, thereby compromising patient welfare. Ethically, this represents a failure to provide competent care and a breach of the veterinarian's duty to the animal. From a regulatory perspective, while specific Act regulations might not detail every biopsy technique, the overarching expectation is adherence to accepted veterinary medical practices, which this approach would violate. Another incorrect approach, such as submitting a poorly preserved or inadequately fixed sample, would also be professionally unacceptable. Proper fixation can lead to artifactual changes in tissue morphology, rendering histopathological interpretation unreliable. This directly impacts the accuracy of the diagnosis and subsequent treatment decisions, again failing to meet the standard of care and ethical obligations. Finally, an incorrect approach that relies solely on gross appearance without obtaining a biopsy for histopathological confirmation, especially for lesions with ambiguous or potentially neoplastic characteristics, would be a significant professional failing. This bypasses a fundamental diagnostic tool in veterinary dermatology, increasing the risk of overlooking serious conditions and failing to provide the comprehensive diagnostic workup expected of a specialist. The professional decision-making process for similar situations should involve a thorough assessment of the lesion's clinical characteristics, including its depth, morphology, and suspected etiology. This assessment should guide the selection of the most appropriate biopsy technique, e.g., punch biopsy, excisional biopsy, shave biopsy, and the subsequent handling of the specimen to ensure optimal histopathological evaluation. Consultation with a board-certified veterinary pathologist is often an integral part of this process, especially for complex or unusual cases. The ultimate goal is to obtain the most accurate and informative diagnosis possible to guide effective patient management. Question 9. The analysis reveals a 5-year-old Labrador Retriever presenting with severe, generalized pruritus of 3 months duration. Initial treatments for fleas and secondary pyoderma have provided only minimal relief. The pruritus is worse at night and appears to be exacerbated by stress. The owner reports no significant changes in diet or environment. Considering the differential diagnoses for pruritus in dogs, which of the following diagnostic and therapeutic strategies best reflects a systematic approach to identifying and managing the underlying mechanisms of this animal's itch, adhering to best practices in veterinary dermatology? Option A. Conduct a thorough ectoparasite recheck, obtain skin scrapings and fungal cultures, and then initiate a strict hypoallergenic diet trial for 8 weeks. Option B. Administer a broad-spectrum antiparasitic medication and a course of topical antimicrobial therapy, followed by a trial of an oral antihistamine. Option C. Initiate a trial of a novel protein or hydrolyzed diet, while simultaneously performing a complete blood count and serum biochemistry panel to assess for systemic disease. Option D. Perform intradermal allergy testing and initiate immunotherapy, while also prescribing a short course of oral corticosteroids to manage the immediate discomfort. The correct answer is D. Perform intradermal allergy testing and initiate immunotherapy, while also prescribing a short course of oral corticosteroids to manage the immediate discomfort. Explanation. The analysis reveals a complex dermatological case where a dog presents with intense pruritus, necessitating a thorough understanding of the underlying mechanisms to guide effective treatment. The challenge lies in differentiating between the various pruritic pathways, as a misdiagnosis can lead to prolonged suffering for the animal, owner frustration, and potentially iatrogenic complications from inappropriate therapies. Best professional practice, guided by the principles of veterinary dermatology and ethical client communication, dictates a systematic diagnostic approach that prioritizes identifying the primary drivers of itch. This involves considering both peripheral and central mechanisms, as well as the interplay between them. The correct approach represents best professional practice by focusing on a stepwise diagnostic process that systematically evaluates the most common and treatable causes of pruritus, while also acknowledging less common but significant etiologies. This aligns with the DACVD commitment to evidence-based medicine and patient welfare. By prioritizing the identification of primary causes such as ectoparasites, infections, and allergic diseases. Veterinarians can implement targeted therapies that address the root of the problem, rather than merely suppressing symptoms. This methodical approach minimizes unnecessary diagnostic procedures and medication trials, thereby reducing costs and potential side effects for the patient. Furthermore, it fosters a strong veterinarian-client relationship built on trust and transparency, as owners are kept informed of the diagnostic rationale and treatment plan. Incorrect approaches fail to adhere to these principles. One incorrect approach might involve immediately initiating broad-spectrum immunosuppressive therapy without a thorough workup. This is ethically problematic as it risks masking underlying treatable conditions, potentially leading to delayed diagnosis and worsening of the primary disease. It also exposes the animal to the risks associated with immunosuppression unnecessarily. Another incorrect approach could be to solely focus on symptomatic relief without investigating the underlying cause. This is professionally deficient because it does not address the root of the pruritus, leading to a chronic, relapsing condition and failing to meet the standard of care expected of a veterinary dermatologist. It also represents a failure in client education and expectation management, as the owner may believe the problem is being solved when it is merely being masked. A third incorrect approach might be to dismiss the possibility of central pruritus without adequate consideration, especially in cases refractory to standard peripheral treatments. This can lead to a misdiagnosis and a failure to explore alternative therapeutic avenues that could significantly improve the patient's quality of life. The professional decision-making process for similar situations should involve a comprehensive history, a thorough dermatological examination, and a systematic diagnostic plan. This plan should begin with ruling out common causes of pruritus, such as ectoparasites, fleas, mites, superficial bacterial and yeast infections, and then proceed to investigate allergic etiologies, food allergy, atopic dermatitis. If these are ruled out or inadequately treated, consideration should be given to less common causes, including immune-mediated diseases, endocrine disorders, and, in refractory cases, central pruritic pathways. Throughout this process, clear communication with the owner regarding the diagnostic steps, potential outcomes, and associated costs is paramount. Question 10. Benchmark analysis indicates that while dermatoscopy is a valuable tool for enhancing diagnostic accuracy in veterinary dermatology, its interpretation can be complex and requires integration with other diagnostic modalities. A DACVD Diplomate is presented with a canine patient exhibiting a multifocal alopecia and hyperpigmented lesion. Dermoscopic examination reveals prominent follicular casts, irregular pigmentation patterns, and dilated follicular ostia. Considering the potential differential diagnoses and the expected standard of care for a board-certified specialist, which of the following diagnostic approaches best reflects current best practices and ethical obligations? Option A. Perform dermatoscopy as part of a comprehensive diagnostic workup, integrating the findings with cytology and potentially histopathology to formulate a definitive diagnosis and treatment plan. Option B. Advise the owner that dermatoscopy is sufficient for diagnosis in most cases and that further testing is generally unnecessary unless the condition fails to resolve with initial therapy. Option C. Initiate a treatment trial for a common condition suggested by the dermatoscopic findings, monitoring for response before pursuing further diagnostics. Option D. Rely solely on the dermatoscopic findings to establish a definitive diagnosis and prescribe a targeted treatment regimen. The correct answer is C. Initiate a treatment trial for a common condition suggested by the dermatoscopic findings, monitoring for response before pursuing further diagnostics. Explanation: this scenario is professionally challenging due to the inherent variability in dermatoscopic findings and the potential for misinterpretation, which can directly impact patient care and owner expectations. The DACVD Diplomate is expected to possess a high level of diagnostic acumen, integrating dermatoscopic evidence with clinical presentation, history, and other diagnostic modalities. The core challenge lies in distinguishing subtle, yet significant, dermatoscopic features that differentiate benign conditions from those requiring aggressive treatment or indicating a poor prognosis, all while adhering to the ethical and professional standards expected of a board-certified specialist. Correct approach represents best professional practice because it prioritizes a comprehensive diagnostic strategy that leverages dermatoscopy as a valuable, but not exclusive, tool. This approach aligns with the principles of evidence-based veterinary medicine and the ethical obligation to provide the highest standard of care. By integrating dermatoscopic findings with a thorough clinical assessment, including cytology, histopathology, and response to therapy, the Diplomate ensures a robust diagnosis and a tailored treatment plan. This systematic methodology minimizes diagnostic error and optimizes patient outcomes, fulfilling the expectations of the DACVD certification, which signifies advanced expertise in veterinary dermatology. An incorrect approach that relies solely on dermatoscopy without further diagnostic confirmation is professionally unacceptable. This failure constitutes a breach of the standard of care, as dermatoscopy alone may not provide definitive diagnoses for all dermatological conditions. Over-reliance on a single diagnostic modality can lead to misdiagnosis, delayed or inappropriate treatment, and potential harm to the patient. Ethically, this approach fails to uphold the duty of care owed to the patient and the client, as it does not employ all reasonably available and appropriate diagnostic tools to establish an accurate diagnosis. Furthermore, it may violate guidelines implicitly or explicitly set forth by veterinary professional organizations regarding diagnostic thoroughness for board-certified specialists. Another incorrect approach that involves making definitive treatment decisions based on preliminary or equivocal dermatoscopic findings without corroborating evidence is also professionally unsound. This can lead to unnecessary or ineffective treatments, causing financial burden to the owner and potential adverse effects for the animal. It demonstrates a lack of critical evaluation and a failure to adhere to a systematic diagnostic process. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly gather patient history and perform a complete physical and dermatological examination. 2. Utilize dermatoscopy as an adjunct to visualize superficial structures and identify characteristic patterns, but recognize its limitations. 3. Select and perform appropriate ancillary diagnostic tests, e.g., cytology, fungal culture, bacterial culture and sensitivity, skin scraping, biopsy for histopathology, based on the differential diagnoses generated. 4. Integrate all diagnostic findings to formulate a definitive diagnosis. 5. Develop and implement a treatment plan based on the confirmed diagnosis, with clear communication to the owner regarding prognosis and expected outcomes. 6. Regularly reassess the patient's response to therapy and adjust the treatment plan as needed, utilizing further diagnostics if indicated. Question 11. Risk assessment procedures indicate that a canine patient presents with a generalized pruritic papulonodular dermatitis of several weeks' duration. Initial dermatological examination reveals scaling, erythema, and excoriations. A comprehensive list of differential diagnoses has been generated, including parasitic infestations, bacterial folliculitis, malassezia dermatitis, and allergic dermatitis. Which of the following diagnostic approaches best represents a systematic and ethically sound progression for this case? Option A. Recommend a complete blood count, serum biochemistry profile, and urinalysis to assess for underlying systemic disease contributing to the dermatitis. Option B. Initiate a broad-spectrum antibiotic and antifungal trial, followed by a strict hypoallergenic diet trial. Option C. Perform immediate intradermal allergy testing to identify specific environmental allergens. Option D. Obtain skin scrapings for ectoparasite evaluation, perform impression cytology of affected skin, and consider a diagnostic trial for sarcoptic mange. The correct answer is C. Perform immediate intradermal allergy testing to identify specific environmental allergens. Explanation. This scenario presents a common challenge in veterinary dermatology where a definitive diagnosis is not immediately apparent, requiring a systematic and evidence-based approach to diagnostic testing. The professional challenge lies in balancing the need for accurate diagnosis with client financial constraints and the potential for iatrogenic complications from empirical treatments. Careful judgment is required to select the most appropriate diagnostic pathway that maximizes diagnostic yield while minimizing risk and cost. The correct approach represents best professional practice because it prioritizes a tiered diagnostic strategy, starting with the least invasive and most cost-effective tests that can rule out common differentials. This aligns with the principles of responsible veterinary practice, emphasizing client communication and informed consent regarding diagnostic options and their associated costs and benefits. By proceeding systematically, the veterinarian avoids premature or inappropriate treatments that could complicate future diagnostics or lead to unnecessary expense and patient discomfort. This approach is ethically sound, as it prioritizes patient welfare and client trust by demonstrating a thorough and considered diagnostic plan. An incorrect approach involving immediate empirical treatment without further diagnostics is professionally unacceptable. This bypasses essential diagnostic steps, potentially masking underlying conditions or leading to ineffective treatment, which is a failure in professional duty of care. It also represents a potential financial burden on the client without a clear diagnostic rationale, which can erode trust and violate ethical principles of transparency and responsible resource allocation. Furthermore, initiating treatment without a diagnosis can lead to antimicrobial resistance if antibiotics are used inappropriately, a significant public health concern that veterinary professionals have a responsibility to mitigate. Another incorrect approach, such as recommending a highly specialized and expensive diagnostic test as the initial step without ruling out more common causes, is also professionally unsound. While advanced diagnostics are valuable, their use should be guided by clinical suspicion and the failure of less invasive methods. Recommending such tests upfront without justification can be seen as financially exploitative and may not be the most efficient path to diagnosis, potentially leading to unnecessary stress and cost for the client and patient. The professional decision-making process for similar situations should involve a thorough history and physical examination to generate a list of differential diagnoses. This list should then be prioritized based on prevalence, severity, and treatability. A tiered diagnostic plan should be formulated, starting with basic, cost-effective tests, e.g., cytology, skin scraping, to rule out common causes. Client communication is paramount throughout this process, discussing the diagnostic plan, potential outcomes, costs, and alternative options. If initial diagnostics are inconclusive, the plan should progress to more advanced or invasive tests, always with client consent and understanding. This systematic, evidence-based, and client-centered approach ensures optimal patient care and upholds professional standards. Question 12. During the evaluation of a 7-year-old Labrador Retriever presenting with generalized pruritus, erythema, and scaling, the owner expresses significant financial concerns and states they have a strict budget for diagnostics and treatment. The veterinarian, a DACVD Diplomate, has identified several potential inflammatory dermatoses, including allergic dermatitis and autoimmune conditions, which could require extensive and costly diagnostic workups such as intradermal allergy testing, serum allergy testing, or skin biopsies with histopathology. Which of the following approaches best balances the ethical obligations to the patient and the client's financial constraints while adhering to the principles of veterinary dermatology? Option A. Proceed with skin biopsies for histopathological examination and intradermal allergy testing concurrently, as these are considered the gold standard for diagnosing inflammatory skin diseases, and inform the owner of the total estimated cost afterward. Option B. Discuss a tiered diagnostic approach, starting with less expensive, less definitive tests, e.g., cytology, fungal culture, response to empirical therapy for common parasites, and progressing to more advanced diagnostics only if initial steps are inconclusive and the client's financial situation allows. Option C. Prescribe a broad-spectrum immunosuppressive therapy based on the most common presumptive diagnosis of allergic dermatitis, without performing any further diagnostic tests, to provide immediate relief to the patient. Option D. Recommend immediate referral to a specialized diagnostic laboratory for comprehensive serological testing for a wide range of allergens and autoimmune markers, regardless of the owner's stated budget, emphasizing that this is the only way to achieve a definitive diagnosis. The correct answer is B. Discuss a tiered diagnostic approach, starting with less expensive, less definitive tests, e.g., cytology, fungal culture, response to empirical therapy for common parasites, and progressing to more advanced diagnostics only if initial steps are inconclusive and the client's financial situation allows. Explanation. This scenario presents a professional challenge due to the inherent conflict between providing the best possible medical care for a patient and respecting the financial limitations and informed consent of the client. The veterinarian must navigate the complexities of diagnosing and treating inflammatory skin conditions while adhering to ethical principles and professional standards. The DACVD role emphasizes advanced diagnostic and therapeutic capabilities, which can sometimes involve significant cost. Balancing these factors requires careful communication, thorough client education, and a commitment to ethical practice. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic process that is tailored to the client's stated financial constraints. This involves open and honest communication with the client about diagnostic options, their associated costs, and the potential benefits and limitations of each. By offering a tiered approach to diagnostics, the veterinarian respects the client's autonomy and financial realities while still striving for an accurate diagnosis and effective treatment plan. This aligns with the ethical obligation to act in the best interest of the animal while also being mindful of the client's circumstances. The American Veterinary Medical Association, AVMA, Principles of Veterinary Medical Ethics, which guide DACVD diplomates, emphasize honesty, integrity, and the importance of informed consent. An incorrect approach that prioritizes aggressive, potentially cost-prohibitive diagnostics without adequate client consultation fails to respect client autonomy and informed consent. This could lead to financial hardship for the client and potentially compromise the veterinarian-client-patient relationship. Ethically, this approach could be seen as a failure to adequately consider the client's financial limitations, which are a crucial component of a successful treatment plan. Another incorrect approach that involves recommending a treatment plan without a definitive diagnosis, based solely on presumptive findings, risks ineffective treatment, potential adverse drug reactions, and unnecessary financial expenditure for the client. While some inflammatory conditions can be treated empirically, a lack of diagnostic investigation, especially when feasible within the client's budget, falls short of the high standards expected of a DACVD. This could be considered a failure to provide competent care, as it bypasses essential diagnostic steps that could lead to a more targeted and effective therapeutic strategy. A further incorrect approach that involves withholding information about less expensive, but potentially less definitive, diagnostic tests in favor of more advanced, costly options, undermines transparency and informed consent. This could be viewed as a breach of trust and a failure to uphold the ethical obligation to provide clients with all relevant information to make informed decisions about their pet's care. The professional decision-making process for similar situations should involve 1. Active listening to understand the client's concerns and financial limitations. 2. Comprehensive client education regarding the nature of inflammatory skin diseases, diagnostic possibilities, and associated costs. 3. Collaborative development of a diagnostic and treatment plan that aligns with the client's resources and the patient's needs. 4. Regular reevaluation and open communication throughout the diagnostic and treatment process. Question 13. Operational review demonstrates a consistent pattern of cases presenting with intense pruritus, erythema, and excoriations, where initial empirical treatments for common bacterial or yeast infections yield only transient improvement. The diagnostic challenge lies in differentiating between primary allergic dermatoses and other inflammatory conditions that may present with similar clinical signs. Which diagnostic and therapeutic approach best reflects the current understanding of the pathophysiology of such dermatoses and adheres to best practices in veterinary dermatology? Option A. Perform a thorough dermatological examination, obtain a detailed history, and systematically pursue diagnostic tests such as cytology, skin scrapings, fungal culture, and consider an elimination diet trial or intradermal/serological allergy testing to identify the primary underlying cause of pruritus. Option B. Prescribe a potent corticosteroid to immediately control the pruritus and inflammation and reevaluate the case in 4 weeks. Option C. Focus solely on managing the secondary bacterial and yeast infections with topical and systemic antimicrobials, assuming the primary issue will resolve once these are cleared. Option D. Initiate a broad-spectrum antibiotic and antifungal therapy while awaiting results of a comprehensive diagnostic workup for parasitic causes. Correct answer is D. Initiate a broad-spectrum antibiotic and antifungal therapy while awaiting results of a comprehensive diagnostic workup for parasitic causes. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary dermatology where a clinician must differentiate between primary disease processes and secondary complications. Misinterpreting the underlying pathophysiology can lead to inappropriate treatment, prolonged suffering for the animal, and owner dissatisfaction, potentially impacting the veterinarian's professional standing and adherence to standards of care. The complexity arises from the overlapping clinical signs of various dermatological conditions and the need for a systematic diagnostic approach. Correct approach analysis. The correct approach involves a thorough history, physical examination, and targeted diagnostic tests to elucidate the primary disease mechanism. This aligns with best practices in veterinary medicine, emphasizing evidence-based diagnostics and a differential diagnosis process. Specifically, for pruritic dermatoses, understanding the pathophysiology of allergic reactions, e.g., atopic dermatitis, flea allergy, dermatitis, food allergy, versus parasitic infestations, e.g., sarcoptic mange demodicosis, or infectious causes, e.g., bacterial pyodema, Malassezia dermatitis, is paramount. A systematic approach, including cytology, skin scrapings, fungal cultures, and potentially allergy testing or elimination diets, is crucial for accurate diagnosis and effective management, thereby upholding the veterinarian's duty of care and professional competence as expected by the DACVD standards. Incorrect approach is analysis, an approach that solely relies on empirical treatment without a diagnostic workup for pruritus fails to address the root cause. This is a regulatory and ethical failure as it deviates from the standard of care, potentially leading to ineffective treatment, unnecessary drug exposure, and delayed diagnosis of a more serious underlying condition. It demonstrates a lack of due diligence and professional responsibility. An approach that prematurely attributes pruritus to a single, unconfirmed cause without ruling out other common differentials is also problematic. This can lead to misdiagnosis and inappropriate therapy. Ethically, it represents a failure to provide comprehensive diagnostic services and a potential breach of the veterinarian client-patient relationship by not thoroughly investigating the animal's condition. An approach that focuses exclusively on managing secondary infections without investigating the primary cause of the skin disease is another failure. While treating secondary infections is important, it does not resolve the underlying issue driving the inflammation and pruritus. This is a failure in diagnostic reasoning and a deviation from best practices, potentially leading to recurrent problems and a compromised standard of care. Professional reasoning. Professionals should approach pruritic dermatoses with a structured diagnostic plan. This involves gathering a comprehensive history, performing a thorough dermatological examination, and formulating a list of differential diagnoses based on signalment and clinical signs. Diagnostic tests should then be employed systematically to rule in or rule out these differentials, starting with the most common or easily identifiable causes. Treatment should be tailored to the confirmed underlying pathophysiology, with concurrent management of secondary complications. This iterative process ensures accurate diagnosis, effective treatment, and adherence to the highest standards of veterinary dermatological practice. Question 14. Process analysis reveals a canine patient presenting with erythematous, pruritic papules and plaques on the ventral abdomen and medial thighs, consistent with contact dermatitis. The owner reports the dog has recently been walked in a new park with dense vegetation. Considering the diagnostic and therapeutic principles expected of a diplomate of the American College of Veterinary Dermatology, which of the following diagnostic and treatment strategies represents the most appropriate initial approach? Option A. Advise the owner to avoid the suspected new park and prescribe a short course of topical anti-inflammatory medication, with a plan for patch testing if signs persist. Option B. Administer a broad-spectrum antiparasitic treatment to rule out ectoparasites and then begin a hypoallergenic diet trial. Option C. Initiate a course of oral corticosteroids and topical antimicrobial therapy while observing for clinical improvement. Option D. Perform intradermal allergy testing to identify potential environmental allergens, and then initiate a targeted immunotherapy protocol. Correct answer is C. Initiate a course of oral corticosteroids and topical antimicrobial therapy while observing for clinical improvement. Explanation. The scenario presents a common but complex dermatological challenge, distinguishing between different forms of contact dermatitis and implementing appropriate, evidence-based treatment. The professional challenge lies in the potential for misdiagnosis, leading to ineffective or even harmful treatments, and the need to balance diagnostic accuracy with client communication and cost-effectiveness. Careful judgment is required to interpret clinical signs, select appropriate diagnostic tests, and tailor treatment to the specific etiology and severity of the dermatitis, all while adhering to the highest standards of veterinary care as expected of a DACVD diplomate. The correct approach represents best professional practice by prioritizing a systematic diagnostic workup that directly addresses the suspected cause of contact dermatitis. This involves a thorough history, meticulous physical examination, and the judicious use of diagnostic tools like intradermal testing or patch testing, guided by the most current scientific literature and consensus guidelines in veterinary dermatology. This approach ensures that treatment is targeted, effective, and minimizes the risk of adverse reactions or exacerbation of the condition. It aligns with the ethical obligation to provide competent and evidence-based care, upholding the standards of the American College of Veterinary Dermatology. An incorrect approach that relies solely on empirical treatment without definitive diagnosis fails to meet the standards of a DACVD. This is because it bypasses the critical step of identifying the specific allergen or irritant, which is fundamental to effective long-term management and prevention of recurrence. Such an approach risks prolonged suffering for the animal, unnecessary financial burden on the owner, and potential development of secondary complications. Ethically, it falls short of the commitment to provide the highest level of specialized care and may be considered a deviation from best practices in diagnostic veterinary dermatology. Another incorrect approach that involves aggressive, broad-spectrum immunosuppressive therapy as a first-line treatment without a confirmed diagnosis of immune-mediated disease or severe, refractory contact dermatitis is also professionally unacceptable. While immunosuppressants can be crucial in managing certain dermatological conditions, their use carries significant risks, including increased susceptibility to infections and other systemic side effects. Administering such potent medications without a clear indication and a thorough diagnostic workup is not only potentially harmful, but also ethically questionable, as it prioritizes symptom suppression over accurate diagnosis and targeted therapy. This deviates from the principle of primum non nocere, first, do no harm, and the DACVD commitment to evidence-based judicious use of therapeutics. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive history. Gather detailed information about the onset, progression, environmental exposures, diet, and previous treatments. 2. Thorough physical examination. Systematically assess the distribution, morphology, and severity of lesions. 3. Differential diagnosis. Formulate a list of potential causes, including various types of contact dermatitis, allergic, irritant, other inflammatory dermatoses, and infectious causes. 4. Diagnostic testing. Select appropriate tests based on the differential diagnosis, prioritizing non-invasive methods first, followed by more specific tests like intradermal testing or patch testing for suspected allergic contact dermatitis. 5. Treatment plan. Develop a multimodal treatment plan that addresses the underlying cause, manages inflammation, and prevents secondary complications, with clear communication to the owner regarding prognosis and management. 6. Reevaluation. Schedule follow-up appointments to assess treatment efficacy, adjust the plan as needed, and monitor for adverse effects. Question 15. Regulatory review indicates that a canine patient presents with crusting, erosions, and alopecia, primarily affecting the face, ears, and foot pads. The presumptive diagnosis is pemphigus complex. Which of the following diagnostic and management approaches best aligns with current best practices and regulatory expectations for veterinary dermatologists? Option A. Initiate treatment with a high-dose corticosteroid and a broad-spectrum antibiotic immediately, based on the clinical presentation suggestive of pemphigus complex, with plans for follow-up if the condition does not improve. Option B. Perform skin biopsies for histopathology to definitively diagnose and differentiate between pemphigus foliaceus and pemphigus vulgaris, followed by a treatment plan tailored to the specific diagnosis and patient factors, including comprehensive client education on prognosis and management. Option C. Rely solely on the clinical signs to diagnose pemphigus foliaceus and begin treatment with topical corticosteroids, as this is the most common form and typically responds well to this approach. Option D. Prescribe an oral antibiotic and a topical antifungal agent, as these infections can often mimic or complicate autoimmune skin diseases, and address the suspected autoimmune component only if these initial treatments fail. Correct answer is B. Perform skin biopsies for histopathology to definitively diagnose and differentiate between pemphigus foliaceus and pemphigus vulgaris, followed by a treatment plan tailored to the specific diagnosis and patient factors, including comprehensive client education on prognosis and management. Explanation. Scenario analysis. This scenario presents a common diagnostic and therapeutic challenge in veterinary dermatology, specifically concerning the pemphigus complex. The professional challenge lies in differentiating between pemphigus foliaceus, PF, and pemphigus vulgaris, PV, as their clinical presentations can overlap, and their prognoses and treatment protocols differ significantly. Misdiagnosis can lead to inappropriate treatment, delayed effective therapy, and potentially poorer outcomes for the patient. Furthermore, the management of autoimmune diseases like pemphigus requires careful consideration of immunosuppressive therapy, balancing efficacy with potential side effects, and the need for long-term monitoring, all within the scope of Veterinary Practice Acts and ethical guidelines. Correct approach analysis. The correct approach emphasizes a systematic diagnostic process that begins with a thorough history and physical examination, followed by appropriate diagnostic sampling. Histopathology is the gold standard for diagnosing pemphigus complex, allowing for differentiation between PF and PV based on the level of epidermal cleavage. Direct immunofluorescence, DIF, can further support the diagnosis by identifying characteristic intercellular immunoglobulin deposits. This multimodal diagnostic strategy aligns with best professional practice by ensuring an accurate diagnosis before initiating treatment. The subsequent treatment plan, tailored to the specific diagnosis and patient factors, and involving client education regarding prognosis and management, reflects a commitment to evidence-based medicine and responsible patient care, adhering to the principles of Veterinary Practice Acts that mandate competent diagnosis and treatment. Incorrect approaches analysis. Initiating immunosuppressive therapy based solely on a presumptive diagnosis without definitive histopathological confirmation represents a significant regulatory and ethical failure. This approach bypasses essential diagnostic steps, potentially leading to misdiagnosis and inappropriate treatment, violates the principle of practicing within the bounds of established diagnostic protocols, and could be construed as practicing medicine without sufficient evidence, which is contrary to Veterinary Practice Acts. Relying exclusively on clinical signs for diagnosis without histopathology is insufficient for differentiating pemphigus subtypes and can lead to treatment errors. Furthermore, failing to adequately discuss the diagnostic uncertainties, treatment option, potential side effects, and prognosis with the owner constitutes a failure in informed consent and client communication, which are ethical imperatives and often implicitly or explicitly required by veterinary practice regulations. Prescribing a broad-spectrum antibiotic without considering the underlying autoimmune nature of the lesions is also a failure to address the root cause of the disease, delaying appropriate treatment, and potentially masking or exacerbating the condition. Professional reasoning. Professionals faced with suspected pemphigus complex should adopt a structured decision-making process. This begins with a comprehensive assessment of the patient, including a detailed history and thorough dermatological examination. The next critical step is to formulate a differential diagnosis list, prioritizing pemphigus complex. Based on this, appropriate diagnostic samples should be collected, with histopathology being paramount for definitive diagnosis and subtyping. Ancillary diagnostics like DIF can be considered. Once a diagnosis is established, a treatment plan should be developed in consultation with the owner, considering the specific subtype, patient's overall health, and owner's capacity for long-term management. This plan should include clear communication regarding expectations, potential complications, and follow-up care. Throughout this process, adherence to established veterinary guidelines and ethical principles of client communication and informed consent is essential. Question 16. System analysis indicates that a veterinarian is presented with a canine patient exhibiting classic signs of dermaphytosis, including alopecia, scaling, and crusting. The veterinarian suspects a fungal infection and needs to confirm the diagnosis to initiate appropriate therapy, and advise the owner on potential zoonotic risks. Which of the following approaches best aligns with regulatory compliance and best professional practice for confirming dermatophytosis in this veterinary patient? Option A. Perform a direct microscopic examination of plucked hairs and scale, and based on the presence of characteristic hyphae, prescribe an antifungal medication. Option B. Attempt to interpret a dermatophyte test medium, DTM, culture performed in the veterinary clinic's own laboratory without external validation or quality control. Option C. Collect hair and scale samples from affected areas and submit them to an accredited veterinary diagnostic laboratory for dermatophyte culture on a dermatophyte test medium, DTM. Option D. Collect hair and scale samples and submit them to a local human clinical laboratory for fungal culture, assuming they can process veterinary samples. The correct answer is C. Collect hair and scale samples from affected areas and submit them to an accredited veterinary diagnostic laboratory for dermatophyte culture on a dermatophyte test medium, DTM. Explanation. Scenario analysis. This scenario presents a common diagnostic challenge in veterinary dermatology where a presumptive diagnosis of dermatophytosis requires laboratory confirmation. The challenge lies in ensuring that the diagnostic process adheres to established veterinary laboratory standards and regulatory guidelines to produce reliable and interpretable results, thereby guiding appropriate treatment and preventing the spread of zoonotic disease. Misinterpretation or improper handling of samples can lead to delayed or incorrect diagnoses, impacting patient welfare and public health. Correct approach analysis. The correct approach involves submitting a properly collected dermatophyte test medium, DTM, sample to an accredited veterinary diagnostic laboratory. This represents best professional practice because it ensures that the sample is handled by trained personnel using standardized protocols. Accredited laboratories adhere to quality control measures and regulatory guidelines, such as those potentially overseen by the American Association of Veterinary Laboratory Diagnosticians, AVLD, or similar bodies that set standards for diagnostic accuracy and reliability. This ensures the integrity of the culture, accurate identification of the dermatophyte, and appropriate interpretation of results, which is crucial for effective treatment and client communication, and aligns with ethical obligations to provide competent care. Incorrect approaches analysis. Submitting a DTM sample directly to a human clinical laboratory without prior veterinary laboratory consultation or confirmation of their acceptance of veterinary samples is a regulatory and ethical failure. Human laboratories operate under different regulatory frameworks, e.g., CLIA in the U.S., and may not have the validated protocols or expertise for veterinary samples, potentially leading to inaccurate results or rejection of the sample. Forming a direct microscopic examination of plucked hairs without a confirmatory culture is also problematic. While suggestive, it lacks the specificity and sensitivity of a culture for definitive diagnosis and may miss subtle infections or be confounded by other fungal elements, failing to meet the standard of care for definitive diagnosis. Attempting to interpret a DTM culture in-house without proper training, reference materials, or quality control measures is a significant ethical and professional failure. This can lead to misidentification of contaminants as pathogens or vice versa, resulting in inappropriate treatment, prolonged suffering for the animal, and potential zoonotic transmission, violating the veterinarian's duty of care and professional competence. Professional reasoning. Veterinarians must prioritize diagnostic accuracy and patient welfare. When faced with a suspected dermatophytosis case, the decision-making process should involve 1. Recognizing the need for laboratory confirmation. 2. Selecting a diagnostic method that aligns with established veterinary standards and regulatory oversight. 3. Ensuring proper sample collection and submission protocols. And 4. Seeking interpretation from qualified professionals or accredited laboratories. This systematic approach minimizes the risk of diagnostic error and ensures that treatment decisions are evidence-based, thereby upholding professional responsibility and ethical practice. Question 17. Operational review demonstrates a recurring pattern of superficial pyoderma and folliculitis in canine patients presenting to your practice. While initial empirical antibiotic therapy often yields temporary improvement, many cases experience rapid relapse or fail to achieve complete resolution. What is the most appropriate diagnostic and therapeutic approach to manage these cases effectively and responsibly? Option A. Immediately prescribe a broad-spectrum oral antibiotic with a potent anti-inflammatory agent for a minimum of 4-6 weeks, based on the common presentation of pyoderma. Option B. Initiate empirical oral antibiotic therapy based on clinical signs and common bacterial pathogens, and only pursue culture and sensitivity if the patient fails to respond within 2 weeks. Option C. Perform diagnostic cytology to identify bacteria and inflammatory cells, followed by bacterial culture and sensitivity testing for all cases to guide targeted antimicrobial therapy. Option D. Rely solely on topical antimicrobial shampoos and sprays, adjusting the frequency based on clinical response, without further diagnostic investigation. The correct answer is C. Perform diagnostic cytology to identify bacteria and inflammatory cells, followed by bacterial culture and sensitivity testing for all cases to guide targeted antimicrobial therapy. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a veterinarian to balance the immediate need for symptomatic relief with the imperative to establish a definitive diagnosis and implement a targeted treatment plan for a potentially recurrent or complex bacterial skin infection. The risk of antimicrobial resistance, the potential for underlying conditions contributing to pyoderma, and the need for client compliance in a long-term management plan all contribute to the complexity. Careful judgment is required to avoid over-reliance on empirical therapy without adequate diagnostic groundwork. Correct approach analysis. The correct approach represents best professional practice by prioritizing diagnostic steps to confirm the bacterial etiology and identify the specific causative organisms and their sensitivities. This aligns with the principles of responsible antimicrobial stewardship, a key ethical and regulatory consideration in veterinary medicine, particularly within the U.S. framework, which emphasizes judicious use of antibiotics to combat resistance. Establishing a definitive diagnosis through cytology and culture/sensitivity testing allows for targeted therapy, improving efficacy, reducing the duration of treatment, and minimizing the risk of developing resistant strains. This approach also facilitates the identification of underlying causes, which is crucial for preventing recurrence and ensuring long-term patient welfare, a core ethical duty. Incorrect approaches analysis. One incorrect approach involves solely relying on empirical antibiotic therapy based on clinical signs alone without diagnostic confirmation. This represents a regulatory and ethical failure because it bypasses essential diagnostic steps, potentially leading to the use of broad-spectrum antibiotics unnecessarily, contributing to antimicrobial resistance. It also fails to address potential underlying causes, increasing the likelihood of treatment failure and recurrence, which is a breach of the duty of care. Another incorrect approach is to immediately prescribe a potent, broad-spectrum antibiotic without considering the patient's history or previous treatments. This is ethically problematic as it risks selecting for resistant organisms and may not be the most appropriate treatment for the specific pathogen. From a regulatory standpoint, it demonstrates a lack of due diligence in diagnostic workup and responsible prescribing practices. A third incorrect approach is to focus solely on topical treatments without considering systemic involvement or the need for oral antibiotics in cases of deep pyoderma or widespread infection. While topical therapy is important, neglecting systemic treatment when indicated can lead to treatment failure and prolonged suffering for the animal, violating the veterinarian's ethical obligation to provide adequate care. Professional reasoning. Professionals should approach such cases by first performing a thorough history and physical examination. This should be followed by diagnostic steps, starting with cytology to identify bacteria and inflammatory cells, and then proceeding to bacterial culture and sensitivity testing if initial cytology is inconclusive or if the infection is severe, recurrent, or not responding to initial therapy. This systematic approach ensures that treatment is evidence-based, minimizes the risk of antimicrobial resistance, and addresses the root cause of the problem, thereby upholding professional and ethical standards. Question 18. Compliance review shows a veterinary dermatologist is managing a canine patient with chronic pruritus, and the owner suspects a food allergy. The dermatologist is considering several diagnostic and management strategies. Which of the following represents the most appropriate and evidence-based approach for diagnosing and managing suspected food allergies in this patient, adhering to current veterinary dermatological standards. Option A. Advise the owner to switch to a hydrolyzed protein diet and begin a course of oral corticosteroids to rapidly reduce inflammation and pruritus, with the understanding that this will help identify if food is the culprit. Option B. Immediately initiate a commercially available limited ingredient diet that the owner has not previously tried, with the expectation that pruritus will resolve if a food allergy is present. Option C. Recommend a novel protein elimination diet trial for a minimum of 8-12 weeks, followed by a controlled re-challenge with the original diet if clinical improvement is noted, to definitively diagnose or rule out food allergy. Option D. Prescribe a broad-spectrum antiparasitic treatment and topical anti-inflammatory medications to manage the pruritus while awaiting results from serum allergy testing for common food antigens. The correct answer is C. Recommend a novel protein elimination diet trial for a minimum of 8-12 weeks, followed by a controlled re-challenge with the original diet if clinical improvement is noted, to definitively diagnose or rule out food allergy. Explanation. Scenario analysis. This scenario presents a common diagnostic challenge in veterinary dermatology, differentiating true food allergies from other pruritic dermatoses, particularly atopic dermatitis, which often coexists. The difficulty lies in the subjective nature of clinical signs, the potential for owner compliance issues with elimination diets, and the lack of definitive diagnostic tests for food allergy in dogs and cats. The veterinarian must navigate owner expectations, resource limitations, and the need for a systematic, evidence-based approach to achieve a definitive diagnosis and effective management plan, all while adhering to professional standards of care. Correct approach analysis. The correct approach emphasizes a structured, evidence-based diagnostic process for food allergy, prioritizing a strict elimination diet followed by a carefully controlled re-challenge. This aligns with the current understanding and recommendations within veterinary dermatology, as reflected in DACVD-accepted literature and guidelines. The process involves selecting an appropriate novel protein or hydrolyzed protein diet, ensuring strict adherence by the owner, and monitoring for clinical improvement. If improvement is observed, a re-challenge with the original diet is crucial to confirm the diagnosis. This systematic approach minimizes the risk of misdiagnosis and ensures that management strategies are based on confirmed etiology, leading to better patient outcomes and client satisfaction. This methodology is ethically sound, as it prioritizes accurate diagnosis and effective treatment, minimizing unnecessary or ineffective interventions. Incorrect approaches analysis. One incorrect approach involves relying solely on commercially available hypoallergenic diets without a preceding elimination phase or subsequent re-challenge. This fails to establish a definitive diagnosis, as many dogs and cats with pruritus may show transient improvement on any new diet due to placebo effect or a change in protein source that was not the primary allergen. This approach risks misattributing improvement to a specific diet when the underlying cause remains undiagnosed, potentially leading to prolonged or inappropriate dietary management and continued patient suffering. Ethically, this represents a failure to provide a thorough diagnostic workup and could be considered a deviation from the standard of care. Another incorrect approach is to immediately initiate multiple supplements or medications to manage pruritus without first ruling out or confirming food allergy through a structured elimination diet. Adjunctive therapies can be part of a comprehensive plan. Their use as a primary intervention for pruritus without a confirmed diagnosis of food allergy is premature. This can mask underlying issues, complicate future diagnostics, and lead to unnecessary expense for the owner. It also fails to address the root cause if food allergy is indeed present. This approach is ethically questionable, as it prioritizes symptomatic relief over definitive diagnosis and targeted treatment. A third incorrect approach is to proceed with intradermal or serum allergy testing for food allergens as the primary diagnostic tool. While these tests have a role in identifying environmental allergens, their utility in diagnosing food allergies in companion animals is widely considered unreliable and not supported by robust scientific evidence for routine clinical use in diagnosing food allergy. Relying on these tests for food allergy diagnosis can lead to false positives and negatives, resulting in misdiagnosis, inappropriate dietary restrictions, and continued pruritus. This approach deviates from best practices and established diagnostic protocols in veterinary dermatology. Professional reasoning. Professionals should approach suspected food allergies by first performing a thorough dermatological examination and ruling out other common causes of pruritus. If food allergy is suspected, the cornerstone of diagnosis is a strict elimination diet trial. This involves selecting a novel protein or hydrolyzed protein diet that the animal has not been exposed to previously. Owner education and strict adherence are paramount. The diet should be fed exclusively for a minimum of 8-12 weeks, with no other treats, table scraps, or flavored medications. If significant clinical improvement is observed, a controlled re-challenge with the original diet should be performed to confirm the diagnosis. If pruritus returns upon re-challenge, the elimination diet is then reinstituted as the long-term management strategy. This systematic, evidence-based approach ensures accurate diagnosis and effective management, upholding the highest standards of professional practice and ethical responsibility. Question 19. Benchmark analysis indicates that a 5-year-old Labrador Retriever presents with progressive alopecia, scaling, and pruritus affecting the trunk and proximal limbs. Initial examination reveals multifocal areas of follicular casting, hyperkeratosis, and mild erythema. The owner reports no significant changes in diet or environment. Considering the potential involvement of hair follicles and sebaceous glands, which diagnostic and therapeutic strategy best aligns with established veterinary dermatological principles for this presentation? Option A. Immediately initiate a trial of systemic corticosteroids and broad-spectrum antibiotics to manage inflammation and presumed secondary infection, deferring further diagnostics until a response is observed. Option B. Prescribe a novel, expensive topical therapy targeting sebaceous gland dysfunction without performing any initial diagnostic tests based on the breed and lesion description. Option C. Recommend immediate referral for advanced imaging techniques, such as MRI of the spinal cord, to assess for neurological causes of pruritus and alopecia. Option D. Perform in-house cytology and skin scrapings to rule out secondary infections and ectoparasites, followed by empirical treatment for common follicular diseases if initial diagnostics are negative, with consideration for biopsy if no improvement. The correct answer is D. Perform in-house cytology and skin scrapings to rule out secondary infections and ectoparasites, followed by empirical treatment for common follicular diseases if initial diagnostics are negative, with consideration for biopsy if no improvement. Explanation. Scenario analysis. This scenario presents a common diagnostic challenge in veterinary dermatology involving a complex interplay of factors affecting hair follicle and sebaceous gland function. Differentiating between primary follicular disease, secondary infections, and systemic influences requires a systematic and evidence-based approach. The professional challenge lies in accurately identifying the underlying cause to implement effective and targeted therapy, avoiding unnecessary or potentially harmful treatments. The use of diagnostic modalities must be guided by a thorough understanding of the pathophysiology of skin appendages and adherence to established veterinary dermatological principles. Correct approach analysis. The correct approach emphasizes a comprehensive diagnostic workup that begins with a thorough history and physical examination, followed by appropriate in-house diagnostics such as cytology and skin scrapings. This is crucial for identifying immediate causes like secondary bacterial or yeast infections, which are common sequelae to primary follicular dysfunction. If initial diagnostics are inconclusive or suggest a deeper issue, referral for advanced diagnostics like biopsy and histopathology is indicated. This stepwise approach aligns with best professional practice by systematically ruling out common causes and progressing to more definitive diagnostic methods when necessary. This adheres to the principles of responsible veterinary practice, ensuring that diagnostic efforts are efficient and lead to accurate diagnoses, thereby optimizing patient care and minimizing unnecessary interventions. The DACVD framework emphasizes evidence-based medicine and a thorough diagnostic process. Incorrect approaches analysis. One incorrect approach involves immediately initiating broad-spectrum antimicrobial and anti-inflammatory therapy without a definitive diagnosis. This fails to address the underlying cause, potentially leading to treatment resistance, masking the true pathology, and delaying appropriate care. Ethically, This represents a failure to provide competent care by not establishing a diagnosis before treatment. Another incorrect approach is to solely rely on empirical treatment based on a presumptive diagnosis without performing basic in-house diagnostics like cytology. This bypasses essential steps in the diagnostic process, increasing the risk of misdiagnosis and inappropriate treatment, which is contrary to the principles of sound veterinary practice and the rigorous standards expected of a DACVD diplomate. A third incorrect approach is to immediately recommend expensive or invasive advanced diagnostics without first performing simpler, less costly, and readily available tests. This is not cost-effective for the client and may not be necessary if a diagnosis can be reached through initial investigations. It deviates from a logical and efficient diagnostic pathway, potentially causing undue stress and financial burden on the owner and patient. Professional reasoning. Professionals should approach such cases by first gathering comprehensive historical data and performing a meticulous physical examination. This should be followed by a tiered diagnostic strategy, starting with readily available in-house tests such as cytology, skin scrapings, and fungal cultures. If these are unrevealing or suggest a more complex etiology, then referral for advanced diagnostics like biopsy and histopathology, or consultation with a veterinary dermatologist, should be considered. This systematic, evidence-based approach ensures that diagnostic efforts are logical, efficient, and ultimately lead to the most accurate diagnosis and effective treatment plan, upholding the highest standards of patient care and professional responsibility. Question 20. Stakeholder feedback indicates a growing concern among veterinary dermatologists regarding the interpretation of serological tests for autoimmune skin diseases in complex cases. A client presents their dog with a history of progressive, symmetrical erosions and crusting on the mucocutaneous junctions and footpads, along with lethargy and anorexia. Serological testing for anti-nuclear antibodies, ANA, returns a weakly positive result, and a specific test for antibodies against desmosomal cadherins, e.g., anti-desmoglein 1, is negative. The client is eager for a definitive diagnosis and immediate treatment. Considering the nuances of these diagnostic tools, which of the following approaches best reflects a risk assessment-informed, diagnostically sound, and ethically responsible strategy for this patient? Option A. Initiate empirical immunosuppressive therapy based on the weakly positive ANA, acknowledging the negative specific test as potentially a false negative, and reevaluate the patient in 4 weeks. Option B. Advise the client that serological testing is unreliable for autoimmune skin diseases and recommend pursuing alternative diagnostic avenues such as allergy testing, despite the lack of typical allergic pruritus. Option C. Interpret the weakly positive ANA in conjunction with the clinical signs and patient history. Consider the limitations of the desmoglein antibody test, e.g., potential for low antibody titers in early disease or specific desmoglein subtypes not tested, and recommend a skin biopsy for histopathological examination and direct immunofluorescence as the next diagnostic step. Option D. Conclude that a definitive diagnosis of an autoimmune skin disease cannot be made due to the negative specific antibody test and recommend supportive care only, advising the client that the signs are likely nonspecific. The correct answer is A. Initiate empirical immunosuppressive therapy based on the weakly positive ANA, acknowledging the negative specific test as potentially a false negative, and reevaluate the patient in 4 weeks. Explanation. This scenario is professionally challenging because it requires the veterinarian to balance the diagnostic limitations of serological tests for autoimmune skin diseases with the client's desire for a definitive diagnosis and treatment plan. The inherent variability in sensitivity and specificity of these tests, coupled with the potential for cross-reactivity and the influence of concurrent treatments, necessitates a nuanced approach to interpretation and client communication. Careful judgment is required to avoid over-reliance on test results that may not accurately reflect the patient's true immunological status, thereby preventing misdiagnosis and inappropriate therapeutic interventions. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic strategy that integrates serological test results with a thorough clinical evaluation, including dermatological examination, patient history, and potentially other diagnostic modalities. This approach aligns with the ethical obligation to provide competent veterinary care and to make informed decisions based on the totality of available evidence, rather than solely on a single diagnostic test. It also upholds the principle of client transparency by acknowledging the limitations of serological testing and managing client expectations regarding diagnostic certainty. Adherence to established veterinary dermatological guidelines, which emphasize a multifaceted diagnostic process for autoimmune skin diseases, is implicitly followed. An incorrect approach that solely relies on a positive serological test result without considering clinical signs or other diagnostic factors is professionally unacceptable. This failure constitutes a breach of professional competence by potentially leading to a misdiagnosis and the initiation of inappropriate, potentially harmful, immunosuppressive therapies. Ethically, it violates the duty to provide accurate diagnoses and to act in the best interest of the animal patient. Furthermore, it fails to meet the standard of care expected of a diplomate of the American College of Veterinary Dermatology, which demands a sophisticated understanding of diagnostic test limitations. Another incorrect approach that dismisses serological tests results entirely, even when strongly suggestive and correlated with clinical signs, is also professionally unsound. This can lead to delayed or misdiagnoses of potentially serious autoimmune conditions, resulting in prolonged suffering for the animal and increased difficulty in managing the disease once it is eventually identified. This approach neglects a valuable diagnostic tool and can be seen as a failure to utilize all available resources for the patient's benefit, potentially falling short of the expected standard of care. A third incorrect approach that focuses exclusively on the cost-effectiveness of serological testing without adequately considering its diagnostic utility or the potential financial burden of subsequent, potentially unnecessary, treatments is ethically questionable. While cost is a factor in veterinary practice, it should not supersede the primary responsibility to provide appropriate medical care. This approach prioritizes financial considerations over patient well-being and can lead to client dissatisfaction and distrust if diagnostic uncertainties are not adequately addressed. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, a critical appraisal of the available diagnostic tests, including their known limitations and potential for false positives or negatives, and open communication with the client regarding the diagnostic uncertainties and the rationale behind the chosen diagnostic and therapeutic plan. This involves understanding the specific disease entities being investigated, the sensitivity and specificity of the serological assays employed, and the impact of concurrent medications or other factors on test results. The veterinarian must then synthesize this information to formulate a differential diagnosis list and a plan for further investigation or treatment that is tailored to the individual patient and client circumstances.